Welcome, everybody. Thank you for joining us. This is Chapter 4 of our Quality Improvement Plan QIP Journey web series. And in this webinar, we're going to start focusing on change ideas. So we've gone through some measurement and introducing foundational principles to the Quality Improvement Plan. And now we're at the point where we're going to figure out how we're going to actually make all these wonderful things happen. So if you just go to the next slide. Perfect. So for those folks that haven't used Zoom before, we're going to go through some of the basic controls. So in the bottom left, you'll see a microphone as well as a video icon. This is to control your sound and your camera. We do ask that throughout the webinar, if you could please keep yourself on mute and use the chat function, which I'll go over in a moment, to pose a question to the panelists. I will be monitoring the chat throughout the presentation, so please pop it in there and we'll be sure to answer your questions. This webinar is being recorded and we will be posting on our YouTube channel as well as our website. It's great if you can turn on your camera and we can have, it's better to have a conversation that way, but if you prefer to keep your camera off, please feel free to do so throughout the webinar. Thanks, Beth. So if you could just go to the next slide. So in the bottom right, you'll see a little bubble with 3 dots. This is your chat function, so you can bring that up and just type your question in the chat box and see conversations throughout the webinar. And as I mentioned, we do ask that you please use this function if you do wish to pose a question during the presentation. Let me just go to the next slide. So an overview of our learning objectives for today. So we're hoping that at the end of the webinar, you understand the difference between activity and change ideas, understand the PDSA or Plan, Do, Study, Act cycle and how to use it to test your change ideas, understand the relationship between predictions and data collection, understand how to scope your tests. So this is determining what size tests you want to do to test your change ideas for your rapid learning, because you do want to get back your data quickly if you do need to make some adjustments to those wonderful ideas that you have. And we're going to discuss keys to success. So we know that quality improvement is a priority. This has been built into objectives for the Ministry of Health, the Centre of Excellence of the COE, as well as Ontario Health. So as a province, as a sector, we want to improve quality, implement innovative solutions, establish performance indicators to monitor performance expectations, and bring together a unified single team to execute the government strategy, oversee healthcare delivery, improve clinical guidance, and extend and strengthen quality and performance improvement capacities across the continuum of care. Just go to the next slide. Oh, my apologies, there's some animation here. So at the bottom, you'll see an image of a quality improvement plan, and we just see how quality improvement plans can be linked to accreditation and strategic priorities for an organization. So this is one of my favorite slides. As healthcare professionals, we all have 2 jobs, that is providing care and improving care. And this comes to us from Paul Baladin. Just go to the next slide. So this is a recap of what we have learned in the first 3 chapters, and I will just take a moment to state that if you do need to review these chapters, they are all available on our website if you didn't have the opportunity to join us. So some of the key takeaways from the first 3 chapters are starting with what you know and look for what stands out. Use the quality domains, the 6, safe, effective, person-centered, efficient, timely, and equitable, and your strategic directions and operational goals to guide you through the quality improvement plan process. Leverage the experience of others. You're not alone in this. Use data for decision-making. Look for what you do have available. You might have more than you think. So we go over some of those sources that you can check out in, I believe that is chapter 1. Remember, everything that counts can't be counted. Look for your qualitative data. Create a measurement plan and operational definitions. Again, great resources on our website there. Record your measures in the quality improvement plan template. Graphically display and interpret your data, and recognize that there's pitfalls around data collection and analysis and ways to mitigate mitigate those. And just go to the next slide. So I'm very pleased to introduce our panelists today, some of my favorite people. We have Chris Babcock joining us from CMHA Middlesex. She's a Quality and Performance Improvement Officer and Privacy Officer. And we have Laurie Derry, who is an E-QIP Data Coach, as well as Laura Daly-Trottier, who is an E-QIP Quality Improvement Coach. So with that, I am going to hand it over to Laura.
Great, thanks, Ash. So welcome, everybody. I'm excited to be here today. I'm going to move through a few slides, and I think the best part is at the end where we get to hear from Chris. So, but I did want to provide some context today. In this slide, I put this up because really what I wanted to say here is, are you sure? Like before you click OK, when you see a message like this on your system, you really want to be sure. You think about it, you hover your mouse over the OK before you make that final decision. And when you're thinking about quality improvement, you want to analyze and fully understand what your system is telling you before you move forward. And so really that is kind of the context of my next few slides. And often we think we know exactly how to solve the problem. We've thought about it and we're pretty sure we know how to make it better. However, you need to ask yourself, what about root cause? Are we only seeing the symptom of a problem? So this song, which was written by Oscar Hammerstein, How Do You Solve a Problem Like Maria? Some of you might be familiar with this song. I am very familiar with this song. I grew up watching this kind of around the same time every year. And my daughters all can recite most of the lyrics in every song. So this song is something that I'm very familiar with, and it struck me as something that we could talk about in this slide. And this, you know, when you're thinking about the question, how do you solve a problem like Maria, it's really about problem solving and asking questions about why something is happening. So I don't believe that they solved the problem within the lyrics of the song. But my point is that they realized that they had a problem and they didn't have a solution. So let's talk about QI activity or quality improvement activity. So QI science, and in this case, the model for improvement, offers a variety of tools for us to use to help us identify the source of what quality problems might be occurring in our system and focus our improvement efforts. So each tool has its own purpose, and it's important to select the right tool for each analysis or for each series of diagnostics. And those activities need to happen before developing your change ideas, so that you're developing those change ideas based on the underlying root causes. And some of the tools that we have listed here that you could investigate and utilize, you could use all of them or some of them. You don't have to use them all, but some of them are the 5W2H tool, which is used to define your problem statement. The fishbone or the Ishikawa is used as a brainstorming tool for teams to help them understand what the main causes of a quality problem might be. The 5 Whys is used to drill down deeper to get to the root cause of a problem. Pareto charts are used to plot your causes graphically using the 80-20 rule. The data collection, that's the really important piece here that I wanted to mention, is that it's a really simple, at this point, really simple data collection. Something that is, you have some information that you have already that you can use to identify the most important sources of the problem. And process maps are really good ways to outline different steps in a process. So a starting point and an ending point and the steps in between. And once you've completed your analysis of your problem, then you can move forward by creating your aim statement, your goal, and brainstorming those creative change ideas, which is really the fun part. So now, while all changes do not lead to improvement, this is a great quote, all improvement requires change. So change is sometimes challenging and is often difficult to find a good place to start. And this is where change concepts can come in. And a change concept is a general notion that is useful in the development of more specific ideas for changes that lead to improvement. They stimulate critical and creative thinking, which leads to those inventive ideas, those creative ideas. Many change concepts come from the manufacturing industry, as we know, based off of lean methodology, but they're also applicable to the healthcare system. And the improvement guide is a book that we can reference here in terms of listing change concepts. They have in the improvement guide, a practical approach to enhancing organizational performance is a textbook that you can look at. There's a 72, I believe, change concepts that are listed there. And this chart shows 5 of those change concepts and the associated change ideas that you might generate. And in this table, we don't have the specific example related to the change idea, so you'd have to think about your own system. So when you're looking at, for example, managing variation as a change concept, a change idea that you might look at is a standardization of a specific process, maybe the referral process or the process for filing documents, for example, or for an individual to walk through a specific part of your process. You would want to standardize that. Or enhancing the provider-client relationship. So listening to, as the concept, and listening to your clients, tenants, and family members about their experience, and a change idea related to that might be a focus group, or asking specific questions at certain points in the service specific to your client. And then the other piece that we want to remind you about is that there is no one-size-fits-all solution or change idea for reaching your destination. So you have to put these pieces together for the context that fits your environment. And change ideas are tested by running Plan, Do, Study, Act, or PDSA cycles, which are also called tests of change. These tests of change are about learning what works for your system and what does not. And the PDSA cycle, I put this picture up because I thought it was a really great and simple, I'm all about visuals, so for me that was really helpful to see this. And PDSA cycle, it's a rapid test of improvement. So once you've identified your change idea, the PDSA cycle allows for a structured approach to rapid testing of the idea on a small scale. So the plan piece is about, what are we doing now? Is it a big problem? What can we try? And the do is, let's try our plan. So once we've figured out what it is that we're going to do, let's test it out. Let's actually do it. When we study our plan, we're studying, did it work? What is the data that will support whether it did or it didn't? And then based on what we know, what we found out, how can we keep this going? Or should we try something new, a different plan? And some of the pitfalls that I thought we would share with you about PDSAs is that making the tests of change too large or too quickly can be a pitfall for some teams. Not collecting enough data to know if the change occurred. So being very specific about what it is you're wanting to collect so that when you see the information, it's very easy to determine whether you move forward or not. Not writing down the information that you've collected around your PDSA cycle, and then not reviewing it with the team. That's also a really important piece to your PDSA cycles. And not making your predictions of the PDSA cycle outcome. So what you're wanting to know is what, if we do this, what's going to happen, and thinking about what you think might happen, and then referencing that prediction at the study part of your PDSA cycle. And when you're looking at the improvement guide textbook, because I know you're all going to go out there and buy this really quickly, but when you're looking at that improvement guide, it does suggest that in order to facilitate learning and make improvements, you need to do 25 to 50 PDSAs per month. So when you're thinking about how much work would be involved in that, you want to make sure that you do those small rapid cycle tests of change, they would have to be really small in order to generate that number of PDSAs in a month. So just for context. And coming up with an idea, you want to test it. Did it work? Yes or no, and then test again. So for example, when you dressed yourself for work this morning, I would suggest that you likely did about 5 to 7 tests of change about what you would wear. And perhaps maybe only 3, considering that most of us are working from home. So I'm thinking yoga pants, track pants, or PJ pants. But when you go to a restaurant and check out their menu, when you make your choices, whether it's drive-through, takeout, we're doing all of this in COVID style, but you are making decisions in really rapid decisions about what you're going to do, and those are PDSAs. If you share your food with your partner or your family member, every mouthful is a PDSA. So this is the size that we're talking about. And if you're creating a form, every word that you try out and accept or edit is a PDSA. Yes, it is the improvement guide. That's the name of the textbook. And we can put that, if somebody on the team could search up the actual title and link that into the chat box, I would be happy with that. Thank you. Yeah, and so if you you were trying out a new wording in a form, you would want to test that wording out. That would be a PDSA, really small and really rapid. But of course, we don't just do one cycle of test. There is a ramp, and as you can see in this image, we become more and more sure that our theory is correct with the size of the PDSA changes as we're moving from small scale all the way up to the larger, wider scale. And that would show you or tell you that you have some data to support your theory, which would then reduce the risk at the implementation stage. We don't usually implement after one small test, so we suggest that you don't tempt fate and be sure before you do that implementation piece. And when you're thinking about scale of test, this grid is a helpful tool when discussing with your team 2 things. What is the consequence of a failed test? And what is the degree of belief in success of the change? Using one cycle to implementation should only be considered when there is a high degree of belief that the change will be successful. And when there is evidence that the losses from a failed implementation would not be significant, and when there is no way to test the change on a smaller scale. And if tests are not yielding those expected results, teams are wise to stop and try something else. Failed tests are a real gift for teams. And they should be valued as they are critical in building that knowledge around learning and how to refine those ideas for implementation. And tests often may fail, implementation should not. And just this is my last slide before I hand it off to Lori. But you know, again, these are just a few, we talked about pitfalls, but here are some tips. And the things I wanted to bring forward are that you want to think oneness and likely always take one step back or down from where you are, where you think you need to start. So example, if you say to me, you will do this for a day, I would say try it for half a day. And if you tell me you're going to test it for a morning, I would say try it for an hour. And the other one is to drop 2. So if you want to test for a week, try out a change idea for an hour first. So drop it down 2 levels, think a couple of cycles ahead, plan multiple cycles to test and adapt. So you can do small tests of change kind of at the same time as you're moving through. Collect useful data during each test and think big, but test small. And as the Nike slogan says, just do it. Yeah, so that's kind of the PDSAs in a nutshell. And I'm now going to pass it over to Lori. And Lori, I will advance the slides as you wish.
Oh, thank you, Laura.
Mm-hmm.
So, okay. So how do change ideas, PDSA cycles, and process measures align with your quality improvement plan? So we're shifting our focus to the change, or the green section of the template, which aligns with the model of improvement by answering, what change can we make that will result in an improvement? So on the template, we'll be listing change ideas, methods, process measures, and process measure targets. Next slide, please. So before we begin to concentrate on process measures, let's do a quick overview of our family of measures. So outcome measures represent the voice of the client, where are we ultimately trying to go, and are our changes leading to an improvement. Process measures represent the voice of the system. So are we doing the right things to get the outcome, and are our changes working? Balancing measures measure the other parts of the system. They are the changes we are making in one part of the system, causing unexpected changes to other parts of the system. So to tie this all together, there's an example on the bottom of the slide. So our outcome measure is wait time from referral to service initiation. The change idea generated was some standard work. Let's have intake staff prioritize client appointments for assessment within 48 hours of referral. So our process measure is the percentage of client calls made within 48 hours of referral. Next slide, please. Thank you. So let's look at process measures a little more in depth. Process measures are the voice of the system, as I said before, and they tell whether or not the changes we are making are going to have a positive outcome for the client. They drive outcome measures and can only be defined once your change ideas have been generated. These measures speak to the activities that occur in order to create a change in outcome. And depending on your project, this data may only be collected during the testing phase. And they answer these questions. How well is the change working? How might we improve it? And to what extent is the change ready for implementation? Next slide, please. Thanks. So after your change ideas have been generated, we need to form a data collection plan so that everyone is on the same page and we all understand not only what, but how the data is going to be collected. We aren't looking for perfect data here, just enough data to allow us to see if our quality improvement initiative is working. So we've compiled a few tips to help you with your data collection. So the first one is embed the data collection into the work process. So make it easy to do. Be sure to test your data collection tool and plan with potential users before you collect the real data. So test your, if you have a form or a tick sheet, you want to test it first in that PDSA, in that small test, and then start collecting real data. Go for good enough data rather than perfect data in terms of both quantity and quality, and agree on operational definitions in advance. So determine what is it are we measuring. Next slide, please. So once we have data, let's start showing the impact. A run chart, as you can see on the slide, is one of the easiest and most versatile ways of displaying your process measure data. Remember, you should observe movement in your process measure before you see any movement in your outcome measure. And it's okay to use existing data sources. And if not available, make your measurement simple, practical, and if possible, creative. So now I'd like to hand this over to Chris Babcock, who will be discussing the Complaints Awareness Project at CMHA Elgin Middlesex.
All right, hi, can everybody hear me? So I'm not on video because this morning I got rudely kicked out of another meeting and I have a glitchy connection today. So I'm going to share a quick way that we were able to use a current QI project in the creation of our quality improvement plan. I always say that you don't have to create something new when you can use what you already have. My favorite expression is why reinvent the wheel. You may recognize this template from E-QIP called QI on the fly. And just before COVID, we began working on a new QI project to improve awareness of our complaints process. Our problem statement was, since 2016, awareness of CMHA Middlesex's complaint process has been an area for improvement, as demonstrated in our OPOC results. From 2016 to 2018, awareness of the complaint process had declined, with the percentage of participants disagreeing to strongly disagreeing going from 20% to 21.6%. If CMHA Middlesex is unaware of complaints, then services cannot be improved and current and future participants will not receive the best services. So you can see what we want to decrease, that the percentage of participants disagreeing and strongly disagreeing moves from 21.6 to 19.5%. Our QI team completed a fishbone exercise and about 3 5-why activities to come up with some root causes, which then led us to create our change ideas. Next slide. Okay, so using the same QI on the fly template, I'm kind of skipping to the change ideas section. And this slide highlights 2 of our change ideas. 1, to review and update our complaint form for all programs, and 2, to create a standard display board or case. And our plan to carry out those change ideas are to share and compare our current form with Elgin, because we've integrated since we began this project, and then create a new form. We're going to communicate that there is a new form and where the new form can be located. We'll be creating a display that meets all of the bullets that I've listed there. And I've skipped the do section from QI on the fly, because the next step I'm going to share is how you can take the information I've shown already from your QI project to inform your QIP. So next slide. How it fits. So when you're at the point of creating your quality improvement plan, think in terms of some of the work that you've already started or are recently starting, and use your project to inform your QIP. So we use Smartsheet, and my colors don't match the QIP template that you've already seen earlier, but you can see the same sections here. Your change ideas go into the planned improvement initiative. And you can see I've listed the display for complaints forms here. The method and results tracking for this idea are simple. We want to see and ensure the form and display are at every site. We want to see that the form and display are in layman terms, that are simple, that they use graphics and are aesthetically pleasing. So our process measures are listed showing how we're going to make things happen. And the next column shows our targets for those measures. So where the measure is managers ensure each site has a display, the target is 100% of sites have the form and display in view. In our Smartsheet, I've added a comments change results section, and this is where we track our results, and kind of here's where we speak to the PDSA cycle. In Q1, we might have tried something that wasn't successful, or maybe it was, and then in Q2, we're going to comment on where we are now, how the changes are going, and what we may have done differently as a result of the work we did in Q1. The assumption being that if we achieve our target for the process measures, then we're going to see a positive impact on our outcome measure. In this case, a decrease in the participants disagreeing or strongly disagreeing with the awareness of our complaints process. So that's really briefly how we use what we're already doing to help inform and create our quality improvement plan. Next slide. Keys to success. So this, you've already kind of heard a little bit of this in the recap, but we've listed the keys to success when getting started, and it's accumulating from webinar 1, Once Upon a Time There Was a QI Journey. So when you begin developing your QIP, be curious and ask questions of the board, senior leaders, managers, direct service staff, and your clients, tenants, and stakeholders. They will have thoughts on your strengths and areas to improve and can help you decide where to start and to set priorities. Look at all of the data you already collect from different data sources, including your complaints and compliments, and use that data for decision making. Think of it over time versus at one point in time. And remember, everything that counts can't be counted, so ensure that you're looking at the qualitative data. Client stories can tell you a lot, and you want to ensure that everyone is defining the data being collected in the same way. And remember that data collection doesn't have to be fancy or electronic. You can consider the stubby pencil data collection method. In QI, we're interested in good enough data, and we want to use that data for learning. So don't let perfection be your enemy of improvement. It's really important to use your clients or tenants in the process from the beginning, and what is important to them and what are their thoughts on how to improve. And also involve them at the beginning, but throughout and all the way into the end as well. Your targets for improvement should be both aspirational and achievable. And my favorite is use what you already have or what you can easily collect that reflects what you're trying to measure. When you're presenting your data, think about your audience. What's meaningful to them? What level of detail do they need? And then today's keys to success is think oneness, don't boil the ocean. Make sure you have revealed the root cause. This is the best way to get to change ideas that will be successful. And process measures drive your outcome measures and can only be defined once your change ideas are generated. And that's me.
Great, thank you so much, Chris. Really appreciate your lens on everything. And if others have had the opportunity to hear her present on these chapter stories, webinars, we've really been enjoying hearing that perspective and applying the learning to your QI projects and your QIP. So I just wanted to pause here. I know that we have covered off on a little bit of information, but wanted to know if you had any curiosities or clarifications or any questions that you had for any of the panelists. We would be happy to hear and answer them. You're welcome to unmute yourselves or type your question in the chat box. And we do have some time to spend on this today, so. Where can we find the tools? So the tools can be found on the website, so eQuip.ca. And there's also on Quorum. You may also look on the Quorum website, and we can certainly provide that information as well. That's a platform that is dedicated to groups who are looking at quality improvement across the province. And there's some really interesting topics there. And there's a question here for Chris. How do you build excitement to doing QI work? What's your secret?
That is a good question. I think I start with when either the team is coming to me, and that's easy because that means that they're already vested in an improvement. But if it's something where I've seen the data and I feel that there might be a need for improvement, I bring in all my people and we decide, yes, there is room for improvement here. When we create the team, what I like to do is sort of shoot out an email to the people that would and should be involved in that project. So whether it's direct service staff and a manager, admin, if it's HR, something like that, and ask people who's interested. And I will always get somebody that is, and it's those people that are vested in it that are really good to have on your team. The other thing I do, and I know that I may burn them out eventually, is I do have about 3 or 4 managers who love QI stuff. And I will volunteer them to do things with me. And they're the people who will also have the connection with the participants that we serve. And so they'll bring people on that they know are committed to the project that can be there from the beginning to the end as well. So it's really about choosing the team and not just the people you know who are going to be easy to work with, but also people that you know might be challenging, and that they'll give you a perspective that you might not have thought of. But really, you know, if you're able to choose 2 or 3 people on your project that you know enjoy that kind of work, then you have some cheerleaders with you to help really keep moving with it.
Most excellent tidbits. So I like that you talk about the QI geeks in your organization and knowing who they are. That's if you can identify those individuals early on, that's very helpful. And that bringing those people on board who may be kind of the naysayers are also very valuable. There is a question here from Lynn. Lynn would like to know, Chris, Would you recommend one form for complaints, compliments? We have been having a discussion at our organization about not being focused on complaints by having a form that captures both.
Good question. Yes, that is something that we're actually inconsistent with, and part of this project is our website calls it a feedback form, and yet our paper copy said complaint. And so our new one, I believe we're calling it a feedback form, and it has on it a little checkbox where there's a complaint, a concern, feedback, or feedback to tick off. So they might not want to say it's a complaint, but they might have a concern, which seems maybe a little less than a complaint. So we will be calling ours a feedback form, but there will be a spot on there to tick off complaint. And part of the reason for that is with accreditation, one of the standards says complaint, and same with the OPOC, it says I would know how to raise a complaint. So we want to make sure that word is on the form, but we're doing a feedback so that complaint is a checkbox. It's funny, I'm talking with my hands and you guys can't see that.
That's okay. Does that answer your question, Lynn? Yes? Okay, perfect. And then there's another thought here that Debbie has offered, is that another thing we often hear is people having solutions from the beginning. What is the secret to not following a path to their solutions? I'll direct that to you as well, Chris, if I may.
Yeah, I just reread it. And I think Debbie was in on one of our meetings before too. It's funny because as we do projects, people start actually catching themselves when they start to generate solutions really fast. So it's really a matter of gently facilitating that. And so as soon as somebody starts going into a solution, you can even come up with a word as a group, like okay, stop. That's a solution. Let's bring it back. And nobody's ever offended. They actually usually laugh at themselves. Oh yeah, we're always so focused on fixing things here. And then they go back to, and it's kind of this constant tug of war. It's a constant battle where you're constantly saying, sounds like a solution. Let's bring it back to some root causes.
Yeah, and Ash is making a statement, hashtag trust the process.
Mm-hmm.
Mm-hmm.
Yeah, I think it's Debbie. I think the other factor that often happens is how invested people come with their particular solution and sort of driving the process towards their solutions. So again, trusting that process, being open to different ideas and inviting the range of change ideas. I mean, that to me is the fun part, is coming up with these creative ways of addressing the root causes and holding out till we get to that point where we can find change ideas.
Mm-hmm. And Alice has contributed a point here as well, that a great root cause diagnostic process will enable people to talk through their ideas. And if the solution is the correct one, then they can test it to be sure. You still need to test it even if you are sure it is a solution. There's lots to be learned in the testing. Yeah, so true. Are there any other questions? Okay, COVID has forced us into many, many PDSAs by virtue of all the changes that are taking place. That's so true. And we've been saying this right from the very beginning, Lynn, is that the work that we are doing in the sector to respond to a global pandemic, it truly is a quality improvement work. And we've coined it the QI on the fly. And you may have already heard us speaking about this. And Chris showed us a great example of what they've done using the QI on the fly template that we have on our website as well, that can really capture that information, because oftentimes we're making these changes in really rapid speed. And Alice is saying, when you approach problems from a learning perspective, it makes it all that much more meaningful and useful to work through tests of change together. Mm-hmm.
And I can say I'm so fortunate. So in our complaint one of the managers, my previous hat before quality was the director of our supportive housing program. And so I had 4 managers who grew up with me in quality improvement, and all 4 of them are absolutely keen on constantly improving and measuring, which is great. And so one of those managers happens to be on the complaints QI project and was the very first one to go, all right, we're ready to try this out, my home. So it was good. We're going to try it in one home to start, and that was volunteered.
Mm-hmm. Yeah, and testing it out in one environment first to see kind of where it's going to work, and then deciding, you know, what were those pieces that did work, and what pieces could we apply to other parts of our system. And so I talked to teams about the negotiable parts of your change idea and the non-negotiable parts. And so what you might be doing in one part of your system may not necessarily apply equally across. And so you can't do the plug and play, I guess is what I'm trying to say. And Alice is making a point, she's written, don't forget to include those who don't believe as well. The naysayers have a lot to contribute, and they are either right or wrong, and both allow you to learn. And it's very good, thank you for that, Alice. And I think Chris also supported that earlier when talking about how to, you know, what's the secret to getting people on board with this work. And sounds like it's okay to be vulnerable and a learner at your organization, Chris. Congratulations, and that's a message from Deb. So yeah, and really being, again, true to the process and looking at your system from a lens of it's okay to be wrong, and it's okay to recognize where something's not going right and be willing to address it and learn more about why it isn't going right. Mm-hmm. Okay, so we are at the time of 1:42. Are there any other thoughts that people wanted to share about their own experiences, or questions for Chris or Lori, for myself? I feel like the chat box has been very rich with information today, so thank you for contributing.
Laura, it's Ash. I just wanted to, before we move on to sharing some resources, ask if folks wouldn't mind just letting us know what part of the province they're joining us from today. I had meant to ask at the beginning, and my apologies, I neglected to do so. So if you could just pop in the chat, which of the 5 regions you're joining us from, either the north, east, west, Toronto, or central, that would be very helpful to know.
Yes, and while folks are typing that information in, thank you, Ash, for the question. There is another one, or the information. Lynn has asked, how do you engage stakeholders who are key to the success of your QI, but who are outside of your organization, i.e. contracted service provider? Well, I will answer that with Lynn, if that's okay, and if others that are on the call have other wisdom and experience, that would be really great to share that in the chat box or unmute yourselves as well. But what I will say is that having, if they are key to the success of your QI project, involving them from the very beginning in your QI project work. So understanding the problem, inviting them to share with you what they see from their perspective as what the problem potentially could be, or the causes contributing to the problem, can be very helpful in engaging them. So that would be one of the suggestions. And also in quality improvement, people can be added in as on a consultative basis. So when you get to a certain point in your QI project and you're recognizing that, oh, we are missing this piece, we're missing this information, we don't know a lot about this, but we do know somebody who does, and they may have some good value in providing information to us, then you would consult with them about the particular piece of the process that you're wanting their input on. They don't need to necessarily have QI background. It can just be, you know, somebody who's willing to have a conversation with you about what it is you're trying to solve. I'm just checking down at the bottom to see if there was, so for example, sorry, Lynn, I'm catching the second half here. For example, we contract psychiatrists to monitor our addiction withdrawal management programs. And so have you, I guess it would be a question as to a missing context, so it's hard, but perhaps we could connect with you offline, Lynn, to help kind of weed that out for you, if that would be helpful. And if there's others on the call that might have some experience with this. Yeah, so if, yeah, and if you're challenged with, you know, sometimes we encounter situations where it's hard to get people to engage, like just there's barriers just to getting them to see the value in engaging. And that can be a bit of a dance, I think. For me, in my experience coaching teams, showing them from the client perspective. So if you're always focusing on client outcome as the reason why you're working on this, and sharing a client's story, so that, you know, two-minute elevator pitch about why this is important. So what? Why are we working on this? And so if you can take it to that level, and explain to the individual that you're challenged with, or individuals that you're challenged with, that this is why you're working on it. That it's not about reporting or, you know, bean counting, or, you know, meeting a certain benchmark on your whatever, but it's actually about client outcomes and improving that. And I think if you can somehow drill it down to that, that you probably would maybe get a crack or an opening where you could move and receive some information from them. I don't know if that's helpful at all, but that would be an approach. It's not as easy as I say, I know that. I know that. Okay. So I'm going to then move forward so that we have time to review with you what we call the outro slides, which Ash has so kindly volunteered to take us through. So I'll pass it over to Ash and I will forward the slides as you wish.
Thanks so much, Laura. So we can go ahead to the next slide. So we're just going to go over a few resources that we mentioned today, as well as some upcoming opportunities available through E-QIP that may be of interest to everybody that's joined us today. So here we have flagged the change concept list that Laura spoke of. These are the list of 72 change concepts from the improvement guide. From there, you can develop some change ideas, and it is available on our website should you wish to not purchase the data improvement guide for yourself. We also have a Plan, Do, Study, Act, or PDSA worksheet available there, and I'm happy to include both of these in addition to the QIP QI on the fly template that we went through earlier today in the follow-up email, which should come out either this afternoon or tomorrow, depending on my own internet connection on how long it takes to upload this video to YouTube. So if we just go to the next slide. So the follow-up to this webinar is Chapter 5. Change is hard, but figuring out where to start is harder. And this is taking place January 19th from 12 to 1 p.m. Eastern Standard Time. And in this webinar, we're going to go over driver diagrams and how they can help you visualize your change ideas. Know how to generate change ideas, so going through some of those activities that break out of our common patterns of thought. We look at the TRIZ and the random word activity, so that's some good fun. We're going to look at the impact effort grid, to how to organize those change ideas that we come up with maybe try to identify some of that low-hanging fruit. So these are organized by your resources and your expected impact on your system from the idea. So we're also going to cover like naming sources of change ideas, in addition to those activities and what we covered off today with the change concepts, other sources where you might get some inspiration. know how to document change ideas in your quality improvement plan. And as always, we'll end with discussing keys to success. So you'll see the registration link at the bottom there. And again, that will be included in the follow-up email that comes out to you shortly. Just go to the next slide. So we do really appreciate feedback from all of these webinars. It really does help us to improve. So a little QI within a QI web series. So we do ask if you could please take a few minutes, it's probably less than 5, to go to the SurveyMonkey link and just share your experience on today's webinar. And we do look at every response and I really appreciate it. The link will also be included in the email. If we just go to the next slide. So this is really exciting stuff. This was launched early in November. For those of you that are familiar with our in-person Foundations to Quality Improvement training or our DIAs offering, we're taking this material and moving it to an online platform, which is now live. We have our first module available, which is our course introduction. And you can see the link to register is there. I will flag a few things just based on the feedback that we have received. You'll be taken to an Eventbrite page, and it can be confusing because it asks you to select a date. This is just how Eventbrite is set up. So even for a virtual event, you have to create a date in order to generate tickets. It doesn't matter which date you select, but as soon as you do register for the event, I get notified and I'll add you to the course through our learning platform, which is Talent LMS. And as soon as you receive that introduction email, you are welcome to access the course material right away. This is, when it is fully built out, will be 7 online modules that are self-directed, which means that you can access the content at your own pace. There's no instructor-led training, so you don't have to wait for myself or Laura to hop on and walk you through the material. You are welcome to go through the material and re-go through the material as you wish. So we expect to be able to load some new content next week, so stay tuned for that. We'll have the full course available by the end of March. We just go to the next slide. So some additional resources that we've referenced throughout the day. Their link to our website is there, www.equip.ca, and you'll see a lot of the resources that we mentioned, as well as other exciting stuff coming from the E-QIP team in the form of news stories. And you can also catch up on the webinars in this series, as I mentioned, as well as our previous web series, our QI on the Fly series that we did in the springtime. So that's a lot of good information there if you're perhaps taking some holiday later this month and want to catch up on some QI on your own time. We just, I'll flag quorum as well. We did talk about quality improvement plans. You're not alone in this, and you should and can leverage the experience of your peers and colleagues in the sector, and quorum is a really great place to do that. So you can connect with others, share your experiences, share your learnings, and the steps to join quorum are indicated there. So you click on there, you create an account, and you look for the E-QIP community of practice, and you'll be all set. And we use Twitter as our social media platform of choice. So you can follow us at equip_on. And if you are doing some QI work and want to tag us, we'd love if you did. It's hashtag equipon. So we can just go to the next slide. So E-QIP also puts out newsletters and communiques when we have some exciting stuff going on, or just want to share what we hear is going on from you folks, from everybody in the sector. So if you wish to join our mailing list, the link to do so is at the bottom there. And we put out large newsletters about once every 2 months, so we won't be flooding your inbox, I promise. We just go to the next slide. So thank you all for your participation, sharing your insight and ideas in today's webinar, and thank you very much to our panelists today, Laura, Lori, and Chris. Your expertise is always welcomed and appreciated, and great to hear your presentation of this material.